Well, welcome to the Understanding the Biological Terrain. And this is episode 3, where we're going to talk about anxiety and depression and how the body is responding in this manner. So the what the biological terrain is gone over in the previous 2 episodes, which I will link in the description below. But there are 2 theories on health. And the first theory is the germ theory. And it was primarily promoted by Louis Pasteur, and he was a chemist that through the new microscope could see germs and considered these to be the reason that people got sick. And he called this the germ theory of disease. And we discussed looking at what health means. I also mentioned why I consider we haven't really achieved health by following this theory. It has brought a lot of good things about, but we really have not achieved health. Almost everybody I know gets sick at some point in time. And so to me, to try to attack every single microbe with antibiotics and sanitation devices like chlorine have not really helped our bodies deal with the so-called bad germs out there. So to me, the biological terrain makes more sense. And this was promoted by Antoine Bechamp, who was a colleague of Louis Pasteur. Now, Louis Pasteur was a very flamboyant and charismatic person, whereas Bechamp was kind of a shy, nerdy kind of guy. And so Pasteur actually got everybody's attention. He was the actor that everybody would turn to. It isn't always the flamboyant person who has the best idea. And science, even though they want you to think it is tried and true, science is fluid and always changing. And that's why there are many scientists who disagree. And it is unacceptable to try and figure out that this is the straight and narrow. It is not so for everybody. There are a lot of people who follow the straight and narrow and get very, very sick. So we have come up with immune compromising conditions. Autoimmune is rampant in our country. And these were not concerns that we dealt with 100 years ago. There was really no such thing as an autoimmune condition back then. So the biological terrain theory teaches us that it is the health of the individual that determines how the body is going to respond to the environment and the lifestyle with which you are living. So, hi, my name is Mary Bourne. I'm a traditional naturopath. I love sharing natural remedies with people, and I hope you come along with me and get a better understanding of the biological terrain. I was thrilled to hear this morning that the Weston Price people are going to be putting on a seminar this coming October, and I'll put more information in the description below because I just now found out about it. It's like flash news to me. And the title is Goodbye Germ Theory. I love it. Yes, that's what I'm teaching. Goodbye germ theory. You haven't worked, and we are seeking other paths. So I'm very excited about this seminar, and it is also available on DVD or USB. So I'll leave the link in the description below. So you don't have to worry about traveling to Kansas City and getting on an airplane and all that stuff. So what I wanted to review is what I call, this is a disease tree. So what biological terrain is the trunk. That's the body of the person. The makeup of the trunk of the person depends on your constitution, what you inherited from your mother and father, and the DNA that transferred through to the umbilical cord to you as a growing infant in your mother's womb. It also is about toxic overload, all the stuff that cell phones and cell towers and the food non-food we eat. It's all of the toxins that our body has to defend us against. Then there's physical trauma. If you've ever been in an accident, if you've had surgery, these all impact your ability to be healthy. Nutritional deficiencies. Oh my word, since the 1920s, when we started to dump chemicals on our crops and tried to make them more proficient so they looked better, but were really not more nutritious. Unresolved trauma and stress. We live in a very stressful time. If you look at the news daily, that is creating stress on your body. If you are involved in discourse, in other words, if you believe some certain way and it is not the majority thinking, that can sometimes cause distress. If you are adamant about it and are trying to convert everybody, I think differently than most of the people I associate with. Even though those are the people that are sick and need what I teach, they don't want to hear it because what I teach often involves personal responsibility. And a lot of people just want to take a pill. And that's how the doctors have unfortunately gotten to this particular era where everybody is taking pills, except me. So then the biological terrain follows up the trunk and it branches out into the systems of the body. So you have the nervous system, you have the immune system, you have the structural system, all of the different systems of the body, and they in turn branch off into other areas too. So we have the respiratory system branches off into lungs and bronchioles and all of your breathing ability, including the sinuses. So now if you get some kind of like you get a cold, that's going to involve the respiratory system generally, and oftentimes digestive system if there's a flu in this virus that you caught, so to speak. There's also all the other chronic conditions because the needs of the body haven't been met, and you end up with arthritis, rheumatoid arthritis, chronic fatigue, heart disease, cancer, all of these things that where the body is starting to shut down and say, enough, I've had enough. I'm too full of toxins. I have infection everywhere. I have inflammation everywhere. So what we want to do is we don't want to work up here. Well, since the cause is down here or even down here, maybe that's where we need to address, and maybe symptomatically taking something that would relieve the pain and inflammation, but not to seek out a drug that's going to cure it all. So anxiety and depression go hand in hand. Now, there's long-term anxiety. This is a condition that is maybe you started dealing with it when you were 2 and 3 years old, but didn't know that you were dealing with it, that you had a fear of potty training or, who knows where the fear comes from, but usually fear is the base for anxiety. And when the particular thing is not met, then you feel depressed. Nobody's paying attention. Your needs are not being met. And so oftentimes stress turns into anxiety. And then when the body can't do anything about it, that's, depression. It's like you give up. So finding out how a person feels about their stress is a starting point. It can often be where you can begin to help them. They may need to get professional help. I've worked with cognitive therapists, people who are more into talk therapy. My specific technique works with removing old baggage, allowing the body to eliminate this old baggage, which unknowingly your emotional response is contributing to it. For an example, you hate flowers. You don't know why you hate flowers, but through this technique, we can track it back that when you were very young, you went to your grandmother or grandfather's funeral, and at that exhibition, you saw the distress that it caused your parents, and that for some reason that really buried, that feeling got buried. And so you associated it with all the flowers that were in the funeral home. So it's really silly little things like that you in your conscious mind said that can't be so, but it is. These are links that your body creates, memories that it creates through scent and touch and different things. Another time would be if you are comforted and somebody taps you on the back. It's a natural comfort response for the person to kind of tap your back. But you associate that tap on the back with another situation which was distressful. So every time somebody tries to comfort you, you're distressed. And then it just gets bigger and bigger from there. So energy medicine can be very helpful. It is often in the form of flower essence therapy, which is the energy to help move these emotions through the body and out, sort of like bubbles in a champagne glass. You know, you see the escape through this effervescence. These emotions just bubble up and out. Oftentimes they don't cause you distress. Oftentimes they occur during the night when you're sleeping, and a lot of times you're not disturbed by them at all. Occasionally the bubble gets trapped under something, and then more emotional therapy has to help remove that. So essential oils will sometimes do the same thing. Sometimes people get a massage, and just the mere pressure of moving that particular muscle out of the way will bring up some kind of an emotion. So I love it. I've been doing it for 40 years, and I love the fact that it helps people in so many ways. So let's talk a little bit about depression. So what is it that doctors will give you an antidepressant, or they'll recommend psychiatric or neurological testing, and from that they will determine different things. Now we're going to get back to what antidepressants can do, but natural medicine will look at diet and vitamin D levels, because we know that the emotions are very much involved when you are low in vitamin D. Water, you know, if you're not drinking enough water, you can become hallucinogenic and psychotic even. If you have ever been in a situation where you were deprived of water, you know what I'm talking about. So these can cause upsets as well. And what about the stress in your life? What's going on with the people you live with? How are your relationships? Maybe there's some toxic relationship that you have to just say goodbye to. Maybe you could improve your diet so that you're getting more nutritionally dense food. And I have a suspicion that the Weston Price conference will address this. And maybe there's some emotional healing support. There's, you know, wonderful ways to help the emotions. There's tapping methods. There are a lot of different ways, and the flower essences that I talked about. There's exercise. Many people benefit reducing stress by exercise. And don't discount sleep. We need sleep. And there are lots of lovely natural ways to support sleep. For example, we don't understand how EMF can affect sleep patterns, but we know that having a cell phone under your pillow or right next to you, you are absorbing those frequencies, and you remember, emotions are energy, or lack of, or too much, or whatever, but energy is involved, and we don't know what this electrical influence might be affecting. Darkened curtains. A good percentage of people, when they are relaxed, cannot close their eyelids all the way. So it raises up just a little bit, and that little bit of light interference can affect their ability to get sound sleep. So dark curtains, drapes are wonderful. And there's a variety of things. There's, you know, white white noise is another way that you can, having something humming in a consistent pattern can often make you drowsy and get to sleep. So let's look at antidepressants. Now, there are herbal options. Just chamomile tea itself can be relaxing and calming and help you. Peppermint oil is a good, lemon oil are both really good to keep you uplifted. Pink grapefruit is another one that is, if you have in an aromatherapy device, you can get that going through the day and help you keep uplifted. I love lemon in my cleaning solutions, and that helps me keep my energy level up when I'm cleaning. Some of the other things that are a little more specific are serotonin enhancers, and the 5-hydroxytryptophan is a precursor to tryptophan. Now, the government through the FDA stopped allowing tryptophan to be available. If you ever had drowsiness after a turkey dinner, turkeys are high in tryptophan, and tryptophan helps to calm the body and allow it to get rest. Now, a lot of people will take the 5-HT in the morning and they are building serotonin through the day, and then at night serotonin turns into melatonin, and melatonin is what helps you fall asleep. St. John's wort. Now, if you're taking any medication, you should not take St. John's wort because it is a powerful medicine that supports the nervous system. There are others. Black cohosh. If there's any pain involved, black cohosh is a wonderful anti-inflammatory that helps to calm pain. Damiana is another one that is a very beneficial herb. Lemon balm, oh my goodness. The benefits of Melissa officinalis is amazing. So lemon balm, which is Melissa officinalis, I use in a lot of remedies because of the nervine effect of it. It is beneficial in supporting the nervous system. Mimosa bark, I don't know a whole lot about that, but that one are traditional naturopaths do use mimosa bark. Rosemary, we know the benefits that rosemary has on the brain and nervous system. SAMe works with the liver. So like when the liver is so full of toxins that it is depressed, it seems to help move that energy. Now, what the drug alternatives are, the SSRIs are serotonin reuptake inhibitors, and they are like Prozac, Zoloft, Paxil. You can look up what the side effects are of this medication. The some of the others are, Wellbutrin, and they all have side effects. The thing with drugs is that they have to prove that the benefits outweigh the risks. And so that means there are risks. In herbal medication, there is no benefit risk ratio because the benefits are so great. Now, the risk ratio is often upset stomach. You might throw up, which means that you're not supposed to have that in your system anyway. It's your body's natural response. Diarrhea, the other way, and your body's trying to get rid of it as quick as it can. But there's no long-term narcotic effect of taking most herbal options that you will find available. The company I use is Nature Sunshine. If you are interested in learning about any of these, the specific herbs, I have a lot of videos on my Health to Home part of my channel, and you can look at those. I also can give you references. On my website, there's information, but again, this is limited. The FDA does not allow you to advertise that this herb can support this particular health concern, because that's the realm of medical doctors. And since I don't have a license, they can't take my license away. But what I can be doing is be put in jail for practicing medicine without a license. And it's an unfortunate thing that we have gotten to this period that herbalists cannot say what they want to say without the challenge of being put in jail. But that's the way it is. That's the society we live in. Antidepressants use among all ages jumped an eye-opening 400% between 1988 and 2008. Now, this information is older. It takes a while to gather information and create studies based on that information. The information that we've received during the COVID crisis, suicide and depression were unbelievable, along with anxiety, because what did you hear? Everything fearful that you can imagine. Everybody's going to get sick, everybody's going to die, the hospital's going to be overloaded. Every time you turned on the TV, or it was everywhere. You couldn't get away from this information unless you were a hermit. But here's the thing: in America, 1 in 10 children 12 and over are taking antidepressant medication. That should give you like, oh my gosh, that should be a wow type of we do not address it at a natural state, and we should never get it to this point. It should always be the natural approach first. Get outside. Too much screen time. Children need fresh air and activity. They should not have all this screen time. And what did they do during COVID? They had to stay home and do their studies on a screen. It was horrendous as far as I'm concerned. Not allowed to see their friends, not allowed to get together. Most of the beaches, the parks, all of these were closed. It was the worst way to handle this situation, because we're all hooked into this germ theory, which is going down the tubes. We're recognizing it's not working. Stop. Listen to your children. Have family meals where they are expected to participate. No screen time. You involve yourself in the conversation. What's going on in your life? How do you feel? Be attentive. What is it? A half hour? 45 minutes at the most? And you can't devote that amount of time to the people that care about you or you care about? Come on. Feelings should be honored and not brushed off. It's like, how can we make you feel better? What's going on? Don't just sweep it under the carpet and say, oh, everything will be okay. Oh, don't listen to them. Be present in your child's life. So let's talk about anxiety. Anxiolytics. Now, there are herbs that are anxiolytics because this is a response of the nervous system. There are times when your nervous system says, beware, there are bears, there's something that you need to be cautious of, but you never need to be in this hyper mode 24/7. There's something wrong, something driving this hyperactivity of the nervous system. Now, there's a product called Zembrin or Skeleterium tortuosum. I love that, tortuosum. It is torturous to be anxious all the time. This product, I can give you more information on, has helped many people be anxious-less. Clue. And it really does help with situational anxiety. So, for example, everybody gets nervous at times or anxious at times because you don't know what the outcome is. It's when you believe the outcome is going to be the worst ever. That's what anxiety is. To not be able to chunk it down and say, what's the worst that's going to happen? Is that really possible? Is it true? Do I need to think that way? Is it making me feel better to think that way? Get your conscious mind involved in it and be reasonable. Because when you're anxious like that, you are farthest away from reasonable. You cannot be reasonable with a person in full anxiety because it is all about, they're so enclosed, they cannot even absorb anymore. They have to be so close to themselves because they can't do anything else. That's where essential oils are very helpful because they're breathing, they're still breathing. And so you can have some aromatics moving through the air, which would help. There are other things, kava kava. I think of kava kava. The brain is still working, but the muscles are mush. So I don't consider kava kava a good anxiolytic. I consider it more of a muscle relaxant. Passion flower does work with the brain to help relax it, to calm it. It is a very good support for calming the brain. Skullcap also. It's getting more difficult to find uncontaminated skullcap. So be sure of your source if you do find skullcap. Supplements like GABA actually works on the way things are transported through the different nerve impulses. CBD, there's been a lot of help. Now, you don't want to take the one that causes addiction. There is like hemp oil. Hemp oil doesn't have the addictive qualities that marijuana, if you're growing marijuana, you don't know exactly what chemicals are involved in it. So make sure, again, that you work with a company that understands the value of supporting the nervous system. L-threonine, it's a fabulous magnesium that supports brain health. Magnesium in herbal medicine is called the relaxer, the mineral relaxer. And there are specific types of magnesium. like if you take the type of magnesium, not citrate or malate. Citrate and malate work toward relaxing the muscles, but there is regular magnesium that you find helps to relax the bowel, which is great. Instead of taking a stool sample or stool softener, you can take magnesium and it oxalate. Magnesium oxalate helps to relax the bowel. If the bowel's too tight, that's when you can't eliminate properly, which is different than if the bowel's too lax. Magnesium will just make diarrhea and doesn't help. So you need a gentle move, something that's going to support relaxing the bowel. And there, you may be magnesium deficient, which also is supported with different magnesiums. There are the essential oils of jasmine, lavender, ylang-ylang, and rose. Now, these are well documented that there's lots of information. Now, unfortunately, the Google and the search engines that we normally get our information from have been very compromised. They all have this mob theory of one-way science, and it's not really where you want to do your research. Find some really good books, go to the library. Google hasn't eliminated the encyclopedia exactly. So now the Nature Sunshine has 2 flower essences that I've had wonderful results with people who need to be more confident. They need to take courage, and those would be the Be Courageous and Find Strength, where they energetically help the body to move through this. For example, if you have test anxiety, you can take the anxious list and Be Courageous and know that it's okay. You can move through this. You've got the information. But if you logically try to tell somebody who is anxious about a test, hey, you got this, that's not going to help, because in their thinking brain, they go, no, I don't. Now, what are the drug alternatives? Well, the drug alternatives, of course, are barbiturates, phenobarbital, benzodiazepines. They all come with some very huge side effects that you really need to know about, because a lot of times people come to me and the condition with which they're coming to me is a direct result of some of the medications that they're taking. I'm 80, and if I go to the medical doctor, which I don't very often, they want me on at least 8 medications, blood pressure medication and cholesterol medication. And it's like, no, check me out. I'm doing pretty good here. So, make sure you're checking into. Now, there are a lot of good websites that will tell you what the proven problems with taking certain medications. Now, you know what? There are times when it's been too long. It has gone too long, and you have to take the medication, but think of it as short term. Now, unfortunately, most medications will take 6 to 8 weeks before they take effect. In the meantime, maybe you could look at your diet, your vitamin D levels, some of the other things that you can improve your sleep. You can improve your water intake. You can do the flower essences no matter what medication you're on, because it doesn't change the way the medication works. It doesn't The problem is how it is, how it works through the liver. Everything you eat and take in goes through the liver. And if there's other stuff in the liver, it may make that medication work either more potently or not work to the way that medical doctors think it should work with you. Whew, that's why it's like they don't really test this medication and this medication and this medication together. They test this medication and then they taste, but not as this vegetable soup type thing where there's so many different things you have no clue on what's counteracting what or what's contributing to a side effect. So first thing is do no harm. That's how medicine started. First of all, do no harm. So try the natural approach first. And then if you see no improvement, seek medical care. What are you doing? What's within your ability to change? Do it. Make yourself healthier. Drugs should not be the first choice. Surgery should not be the first choice. It should be the last resort, in my opinion. Do a multi-approach using many suggestions given, but the biggest suggestion is love. Surround yourself with love. Letting somebody know they matter can go a long way. When I was in the hospital with COVID, I was deprived. I was deprived of good eating. I was deprived of good water. I was deprived of communication. One person could visit me for less than a half hour every day, and they weren't allowed to hug me. I could cry now thinking of those 11 days, how I was deprived. It took me a year to come back from those deprivations. It is criminal the way people are treated in hospitals. Do your absolute best to stay clear. And even medical doctors will tell you that. They are the last resort. They can keep you alive. They can keep you from dying, but they can't keep you alive. So hugs and encouragement, surround if you have somebody who is constantly demeaning you, get them out of your life. Do the best you can at removing them from your life and involve yourself in things that help and support you. Involve yourself with healing vibrations. I want to thank you for, if you've stuck with me all this time, I hope that it's been beneficial, that you've learned something, that you had an aha moment where, you think, I can do something about this. I can be healthier. Even at 80 years old, I got healthier. I'm healthier now than I was at 78. So I encourage you to be as healthy as you can. Work with the biological terrain. Do the comparison. I have linked a great video presentation with Charles Dowding and Dr. Eric Berg. And they did a comparison of human health and plant health and how they compare using biological terrain and biodynamic farming. And I was so thrilled that people are getting aware of how important it is in plant health to work with the dirt and not spray chemicals on it, so that when you enrich the dirt, the plant can uptake what it needs instead of trying to determine, let's say it needs more nitrogen. You know where the chemical nitrogen came from? It was bomb chemicals that not the pharmaceutical, the chemical companies had no more use for, because they didn't make bombs that way anymore. So let's use that nitrogen as a farming tool. Same thing with pesticides. If you look back and follow where these chemicals came from, you would no sooner spray them on your plants that you're going to eat than you would spray them on your body. So the next little peek at what's coming next, we're going to talk about the health of the immune system, and primarily adaptogens. We are also going to cover immune supports, immune boosters. So I hope that you will stay tuned for the next episode of the biological terrain. I really thank you for being with me. I hope that you share this. If you liked it, please give me a thumbs up. And until next time, this is Mary for the health of it.